Good morning, Dr. Patrick. Let's start the warm-up session.
Good morning, Mihiraa. Sure, we can.
Why did you choose to become a doctor?
Medical practice is such a respected profession. I am a person who respects human life and would like to dedicate my life to serving them. I want to save people from suffering, both mentally and physically.
What are the unique and different skills you have as a doctor?
Every doctor has their own special way of treating patients. As a doctor, when there is a sick person who visits me, after diagnosing the patient, I give the list of prescribed tests and, only then, do I give the required medicines. Prescribing medicines without any test is not my way of treating patients.
Your way of handling emergencies and the workload.
In case there is a medical emergency in the hospital, my first step will be to save the patient, rather than getting engaged in the formalities. As a doctor, I know my duties, and I will try my best to do them. I will try to arrange all the specialists if required. Informing the police after taking care of the patients will be my responsibility.
What is your ability to face challenges?
As a doctor, I have to face many challenges daily. So, I have the ability to tackle these challenges very carefully and intelligently, rather than getting hyper. Dealing with challenges faced by a doctor, if not handled properly, can lead to the death of the patient. I have the power to take necessary decisions in situations of an emergency, rather than losing control.
Will you travel if the job demands?
In case of medical emergencies, various hospitals call doctors to treat the patients. I'm ready to travel when called, even to distant places, to treat patients. The medical profession demands flexibility. Medical officers should be flexible. This will help to save each life. It also has advantages in various other ways.
Your time is up. You may please start the role play.
Good morning, Mihiraa. It's good to see you today. I see you're here for a routine prescription refill, but when we checked your blood pressure just now, it was quite high at 162 over 102 millimeters of mercury. Before we go ahead with the refill, I'd like to talk about how you've been taking your blood pressure pills lately.
Good morning, Dr. Patrick. To be honest, I haven't been taking them every day like I'm supposed to. I know my reading is high today, but over the last few months, I've skipped doses quite a bit.
I completely understand why it can be tempting to pause your medication, Mihiraa, especially when you feel perfectly well. High blood pressure is often described as a silent condition because it rarely comes with obvious warning signs or physical discomfort. You can feel completely healthy, vibrant, and energetic on the outside, but those everyday physical feelings simply cannot accurately reflect what is happening inside your blood vessels. Because it operates so quietly without giving you clear cues, assuming everything is fine can leave you vulnerable to sudden, serious health complications down the road. People often step away from their prescriptions for very understandable reasons. Sometimes it is because they feel good, or perhaps they are dealing with uncomfortable side effects, routine disruptions, cost concerns, or simple forgetfulness during a busy day. Sharing what specific challenges made it hard to keep up with your medication will help us find a solution that fits comfortably into your life while keeping your body safe and protected.
Well, doctor, it was mostly the fear of side effects that got to me, but also because I felt completely fine. I didn't feel sick or dizzy, so I thought, why take pills if I feel okay? Plus, sometimes when my daily routine changed on weekends, I would simply forget to take them. So it was a mix of being afraid of what the medicine might do to my body, feeling healthy, and occasionally forgetting.
I appreciate you sharing that with me, Mihiraa. It makes complete sense how feeling good and having a busy routine could lead to missing doses, especially when you're worried about side effects in the back of your mind. Now, I want to talk about how we can address these challenges together and see how you feel about restarting your treatment. There are several ways we can handle these issues smoothly. If you ever experience or worry about side effects, we can manage them directly, adjust your dosage, or even explore alternative medications that your body might tolerate much better. We have many effective options, so you never have to suffer through discomfort or worry in silence. Considering these possibilities, how ready do you feel to restart your medication routine?
That is actually a huge relief to hear, Dr. Patrick. I didn't realize we could just switch medications or adjust the dose if something bothered me. Knowing that gives me a lot more confidence. I definitely want to keep my health on track, so I feel ready to start taking my medication again properly.
I am really glad to hear that you feel ready, Mihiraa, and I appreciate your commitment to your health. Next, I want to explain why keeping your blood pressure under control is so vital for your body, and then I'll answer any questions you might have. When high blood pressure remains untreated over time, it continuously strains your blood vessels, leading to progressive arterial damage. Over the long term, this elevated pressure places a severe burden on vital organs, particularly your heart, your kidneys, and your eyes. Furthermore, leaving it uncontrolled significantly increases your overall risk of suffering a stroke or a heart attack down the road. Protecting your organs from this silent strain is the main goal of our treatment. Do you have any other concerns or questions about what we've discussed so far?
Wow, I didn't realize that high blood pressure could damage my kidneys or eyes without me even feeling it happen. That really puts things into perspective for me. I don't have any other concerns right now, doctor, but I do want to make sure I get back on track safely. What should our plan be moving forward?
I am glad we are on the same page, Mihiraa, and we can easily set up a clear plan to move forward together safely. I will now outline a new management approach for you and set up a time for us to check on your progress. To re-establish control over your blood pressure, we will restart your daily medication today, possibly with a refined plan to minimize any side effect worries. To help with the occasional forgetfulness, setting daily reminders on your phone or tying your pill-taking to a daily habit like breakfast can be very effective. I would also recommend introducing home blood pressure monitoring, where you record your numbers in a logbook at home so we can see how you are doing in your natural environment. Lastly, I would like to schedule a follow-up visit for you in 1 week so we can recheck your blood pressure and see how you are settling back into the routine.
Yes, Dr. Patrick, I will start my medication today, set my daily reminders, track my blood pressure at home, and I will see you in a week for my follow-up.
To summarize everything we've discussed today for your clarity, we recognize that your blood pressure is currently high at 162 over 102 millimeters of mercury because your medication routine was paused due to fears of side effects, feeling healthy, and occasional forgetfulness. We talked about how hypertension is a silent condition that can cause long-term arterial damage and affect your heart, kidneys, eyes, and stroke risk without causing obvious symptoms. To fix this, we agreed to restart your daily medication, manage any side effects if they arise, set daily reminders, start tracking your readings with home blood pressure monitoring, and meet back here in 1 week to review your progress. Does that sound clear and manageable for you?
That is very clear and makes me feel much more comfortable. Thank you for explaining everything so clearly.